All right, so continuing on with the respiratory system disorders, we're going to focus on a few more lower respiratory infections. We'll look at TB, tuberculosis, histoplasmosis, and anthrax. We'll probably spend a little bit more time and focus on TB because it's certainly more relevant. So the etiology, it's Mycobacterium tuberculosis, and this is transmitted by oral droplets from person to person with an active infection. That's really important to know. Active infection. So this will affect people that are living in crowded conditions. We see this in the homeless population, people with immunodeficiency, malnourishment, alcoholism, and conditions of war. We'll see it with some other chronic diseases and, of course, HIV infection, which falls under immunodeficiency. So usually the TB is caused by the M. tuberculosis. It's somewhat resistant to drying and many disinfectants. It can survive in dried sputum for weeks. It is destroyed by UV light, heat, alcohol, glutaraldehyde, and formaldehyde. Okay, but there's a normal neutrophil response does not occur. Okay, the normal neutrophil response does not occur, and there is cell-mediated immunity. And if you think back to the cell-mediated immunity, that's your type 4 reaction, which involves T cells. So there is the cell-mediated response here compared to the B cell with antibodies. Okay, it primarily affects the lungs, but it can affect other organs as well, like the kidneys and the bones. Let's look at the primary infection. When the organism first enters the lung, if the cell-mediated immunity is adequate, then the bacteria is engulfed by the macrophages, and you just get this local inflammation that results. And some bacilli can migrate to the lymph nodes, and that creates that type 4 hypersensitivity reaction. The macrophages and the T lymphocytes, they cluster, right? They cluster around together and they form a granuloma. The granuloma contains live bacilli, and it forms what's called a tubercle, and that's an important concept to know. There's caseation necrosis. Remember when we covered the different types of necrosis, the caseous or caseation necrosis, kind of like cheesy. It occurs in the center of the tubercle. Okay, so again, there's a granuloma that contains the live bacilli. It forms a tubercle, and there's caseation necrosis that occurs in the center of that tubercle. Now, in a healthy person, these lesions can calcify. The tubercle is present on a X-ray or a chest radiograph, and those lesions are referred to as Ghon complexes. Ghon complexes. The bacilli may remain viable in a dormant stage for years. Okay, and that's it. It'll just stay there, doesn't create any other problems. Individuals' resistance and their immune response, if it's high, then the bacilli completely remains walled off. Okay, that primary or latent infection, individuals that have been exposed and effective, they don't have an active disease, right? If it's not active, then they can't be spreaders of it. Okay, it has to be active. So the individual cannot transmit the disease in that primary stage if it's not active. Okay, but in the secondary or the reinfection state, this can occur after the primary infection, where the bacteria in the tubercles become reactivated. Maybe their immune system becomes suppressed. Okay, maybe they just become impaired due to stress or malnutrition, age, older age, or an HIV infection. So the secondary or the reinfection, the mycobacteria begin to reproduce and infect the lung. Now that mycobacterium that reproduce, they begin to destroy the lung tissue. That's where it becomes active TB again. It becomes active tuberculosis, and this is the stage where it is contagious. Okay, you have the destruction of the lung tissue, so you start to get these areas of necrosis, and you get something called cavitation with secondary TB. Cavitation is the formation of a large open area in the lung with erosion of the bronchi and erosion of the blood vessels. And when that happens, cavitation allows for the spread to other parts of the body. That's why we saw it in the bones, we saw it in the kidneys. Okay? So in primary TB, right, it's not really contagious, but in the secondary, it is contagious when it becomes active. Okay, so we have this inhalation of the Mycobacterium TB into the lung, and there is some sort of inflammatory response. Now, either the person has high resistance to it, and they can form that tubercle. Remember, the tubercle is where they have the caseation necrosis plus that granuloma, and the organism becomes walled off, and there's the Gone complex. That's if they have high resistance. Now, if they have low resistance, then it goes right into the cavitation. Okay? If it goes into the cavitation, now you have that active destruction, and it can disseminate and spread to other parts of the body. Okay? If there is that where it becomes walled off, and you have that granuloma, and now that walled off region becomes the walled off region becomes a secondary or active infection again when their resistance becomes suppressed. Okay, so they have high resistance. It forms that Gone, which walls off the area. It's called a granuloma or a Gone complex. Okay, now the Gone complex is quiet. There's no issues with it until their immune system becomes suppressed. Now it becomes reactivated and leads to cavitation. The cavitation destroys the lung tissue. It destroys the blood vessels, and now it can disseminate to other parts of the body. Okay? With TB, there's miliary or extrapulmonary TB, and this can it's a rapidly progressive form in which the granulomas can disseminate into the blood, and they spread to other tissues such as a bone or the kidneys. This is common in kids under 5 years of age and those that are immunosuppressed. If the lesions are not found in the lung, then it is not contagious. The clinical manifestations with primary tuberculosis is asymptomatic. With secondary tuberculosis, that is when it's active. Remember that it's active. It's that insidious onset, anorexia, malaise, fatigue, weight loss, night sweats, and a cough. And that cough becomes severe with the cavitation. When they cough, the blood could be that can create that purulent sputum, right? It's productive with blood inside of it. The diagnostic test is for the first exposure or the primary infection. It can be indicated by a positive TB skin test result. Active infections, there's the acid-fast sputum test plus a chest x-ray, and they can culture the sputum. With TB, this is not something that's treated quickly. It's long-term treatment with a combination of different drugs. They'll use a different type of cocktail here. But the length of the treatment can be 6 to 12 months. TB is becoming an increasingly a serious problem because of homelessness and the crowding in shelters, HIV infections going up, the lack of good health care, and the patients are becoming resistant to the multi-drug effect. Histoplasmosis, this is a fungal infection. It's common in the Midwestern US. It's caused by Histoplasma capsulatum, and this is spread through spores that can be inhaled in dust particles. It is an opportunistic infection, commonly hitting people with the acquired immune deficiency syndrome. The initial stage is usually asymptomatic, and then the second stage, the granulomas form and necrosis, and then they get the cough, the fatigue, the fever, and the night sweats. The treatment for it is going to be antifungal agents. Anthrax, this is a bacterial infection that's caused by a gram-positive bacilli called Bacillus anthracus. Now, this has been used as a biological weapon. It affects the skin. It affects the respiratory tract, which is why we're covering it here, and the GI tract. You inhale the anthrax, and you start with these flu-like symptoms, and then it advances to SARS. Remember, SARS, severe acute respiratory distress, within 3 to 5 days after the exposure. And it's highly fatal. This is why it's used in warfare. The treatment is going to be Cipro or ciprofloxacin, and animal vaccines are available. It's recommended for people that work with organisms or in other professions that might cause the exposure. When we return, we'll cover some of the obstructive lung diseases, cystic fibrosis, and lung cancer.